And she said, our Medicare and Medicaid reimbursement rates are based on what percentage of our patient population goes on the standard of care. And the standard of care for heart disease with your score is the statin. I said, well, I'm not on Medicare and Medicaid. And she said, you didn't hear me. I write about it in the book, by the way, and I just make a little sub note that sounds like my wife when she said, you don't hear me, right? Anyway, so she said, well, you didn't hear me. I said, well, what do you mean? She said, it's our patient population. So if there's enough people like you who won't follow our recommendation, we have to fire you as a patient to keep our reimbursement rates up. And this is the secret. This is how the government, remember, the government is supposed to have limits on it by the Constitution. So how is our government possibly controlling the entire healthcare system? Yeah. This is how. So Center for Medicare and Medicaid Services dictates the reimbursement rates to those prescribers who are taking Medicare and Medicaid patients. They have to convince their entire patient population to follow that standard of care, which includes vaccinations, the statin. It includes chemotherapy for cancer, which, interestingly, chemotherapy for cancer has a 2.1% survival rate post-chemo 5 years.